Hi everybody, Debbie Moore here, and with me today is Lee Covington, who is the Executive Director of Aging, Disability, and Transit Services right here in Rockingham County. And this morning you have launched a new program called At-Home Assisted Living, and we're going to be talking about what at-home assisted living is. Welcome, Lee.
Thank you very much.
First, let's talk about the Rockingham County aging population, because it is the growing population here in Rockingham County.
It is absolutely growing. The numbers really over the next 20 years, we're expecting to double that 60-plus group. It's all those baby boomers that started retiring last
yes,
year,
we are.
and we're both in that crowd.
Yes, we are.
But yes, that group is going to double that 60-plus population over the next 20 years.
Which is really going to stretch our services that are available here in our county.
It is. It's a constant challenge for us. I mean, we all know the environment now with federal and state dollars funding services, and so we've got to find creative ways to meet people's needs as that population just continues to explode.
Absolutely. And I know this morning in the press conference you said something about people that are actually on waiting lists and need things right now, and we're unable to supply those.
That's correct. We currently have, for instance, about 80 folks waiting for Meals on Wheels.
That's bad.
We've got 160 folks waiting for CAP-DA Medicaid waiver services, which provides in-home aid and some other things.
Right.
So these are folks that otherwise would be forced to move to a nursing home or some other type of facility.
Which leads us to at-home assisted living.
Yes.
Let's talk about that. This is something that doesn't depend on the government, doesn't depend on grants, doesn't depend on anything but the client themselves.
That's
so let's
right.
tell folks what at-home assisted living is.
Well, essentially it's a bundle or a package of services that we are making available to folks who may be considering perhaps moving to an assisted living or nursing home facility, but what they really want to do is stay at home as long as possible. And so we can bundle together services such as an in-home aid to assist them with meal prep, with bathing, with dressing, things of that nature,
Right.
Light housekeeping, whatever they need. Transportation, meals, we can do home delivered meals,
Oh, yeah.
and adult daycare, day health services where they can leave their home and go to a center during the day, which will be our Leaf Center in Eden. They can interact with other seniors, people with disabilities, do all kinds of arts and crafts, fun and games, exercise, and then go back home at night and spend the night there.
That's probably, do you take Alzheimer's patients there?
We do.
I was just saying that's a wonderful relief for caregivers.
Oh, absolutely. Absolutely. So that's what this is really all about, sort of taking that concept of bundling services, much like some other corporate groups have done.
Right.
And so, the more services you bundle together and the more you buy, then the cheaper the price.
Cheaper the price.
That's right.
Somewhere I had I think that is still in the hands of my producer. So you have the bronze, the silver, and the gold.
What we've done is we've created 4 package levels. It begins with platinum, which is really a full service package, and it goes gold, silver, and bronze. And then we have a 5th option because we believe there will be folks who maybe don't necessarily want or need all 4 of those services. They may need 2 or 3.
They want to do a la carte.
That's right. And so we have sort of an a la carte or design your own option,
Right.
where they would sit down with our care manager and say, okay, this is what I really need, and then we could price out that plan for them.
Voila,
There
it
it
appeared.
is.
Well, I think one of the things I liked the fact that you could go from 10 hours a week with your bronze package all the way up to your platinum, where you've got 40 hours a week of someone coming in to help you.
That's right. And that's in addition to 5 days a week of adult day health. And so the adult day health program is open. Typically folks are there from 9 to 2 or 9 to 3.
Right.
And so that's 5 to 6 hours of every day, Monday through Friday, that you're in that environment. And then you've got an additional 40 hours
okay,
of someone
so this
actually
is
in
over
your
and
home.
above the day.
Absolutely.
The day setting.
Absolutely. If you look at that package, that has a total of 70 hours of hands-on care every week.
That's pretty good.
It is.
Because then you think of the hours they're sleeping and the hours that they sit in front of a TV, which we're all guilty of. I mean, it's not just our seniors, it's all of us. And yeah, that pretty much works out. But what I thought was pretty incredible, we went into, and I know you said don't ask you any statistics, but I can't find that right this minute, but the difference in the cost of having the at-home, there we go.
That's actually here.
Yeah.
Mm-hmm.
The cost difference
Right.
is what amazed me. So if you've got the long-term care insurance, it pays for this?
It will pay for many of these things.
Right.
Oftentimes it will pay for an in-home aid, it will pay for adult day health services, and so much of this could be paid for by long-term care insurance if you have that. Otherwise, folks would be looking to pay out of their own resources,
Right.
in their bank account or whatever their income might be.
Absolutely. And I've just got to pick this up and look, because the one that got me this morning when we were all going through this, I think it was right here. Assisted living facilities monthly rates. The Greensboro High Point, yeah, it went as high as $60,960
Per year.
per year for some kind of assisted living where you were
Right.
actually at the facility, to using the bronze ADT is $15,670. That's a heck of a big difference.
It is. It's considerably less. And if you look at the nursing home level of care,
Right.
which is an even higher acuity level of care, Greensboro High Point average is $86,000 a year. The statewide average is about $77,000 a year. And even our top package, which is the platinum package, is $47,000
That's
a year.
huge, huge
It
savings.
is a big difference.
And the person is happier because they are where they want to be.
That's
They're
right.
in their own home.
And that's really what this is all about, really trying to support individuals and families for that family member to stay in their home as long as possible. And for some folks, that could be until the day they die.
Sure.
You know, others get to the place where they have to rely on a facility because their needs are just so great.
Right.
But we're trying to prolong that as long as possible, keep folks in their home where they want to be.
Don't you see that they get along a little better when they're able to stay in their own home versus the hospital or assisted living? Or
They do. Well, there's no place like home.
Right, right.
And so I think we would all say that we're all more comfortable in our own space, in our own home. Even if we have to have folks coming in to help provide our care, it's just a more comfortable environment being in your own home where you're used to it.
Absolutely. All right, and we can't go without, we're going to talk about the bus, the SCATs.
Yeah.
I asked you this morning at the press conference, but let's talk about, it's been going fairly well for the Eden area.
Has been.
And the folks over here would like to, in Reedsville, would like to know when possibly we might see it here.
Well, that's a great question. Obviously, we're continuing to work out some kinks and details with the Eden route. We want to make sure that we've got it smooth sailing and everything's working great. And for the most part, it is.
Right.
Don't get me wrong. You know, our ridership's been great. Last month, we had almost 1,500 riders during the month, which was 3 times what we had predicted when we wrote the original grant. And so our challenge is, you know, just to get everything working smoothly and make sure that we're going to be able to effectively replicate it in Reedsville or in Western Rockingham.
Exactly.
So that's still part of our long-range plan. I just can't tell you today that it's going to happen on a certain date because I don't know yet.
I fully understand that. Also, there will at some point be a link between each of these areas with the bus?
Yes,
Yes?
that is the plan. When we have the 3 routes established, that we'll use either minivans or our existing RCATS fleet to connect all those together. And so you can get from Eden to Reedsville or Reedsville to Wentworth or Wentworth to Madison, Mayodan, Stoneville, and then get on those fixed routes and go wherever you need to go within those areas.
That will really be a great day for Rockingham County because there's a lot of folks out there that they really have no other source.
That's true.
So,
and one of the things we're trying to do as best we can in the interim is utilize our volunteer caregiver services division.
Right.
You know, we merged with Caregivers of Rockingham back in January, and we're trying to recruit additional volunteers that are willing to use their personal vehicles. We're going to be talking to some churches as well to try to really beef up that end of it, because there are folks that don't qualify for Medicaid.
right.
If you have Medicaid, transportation is not a problem.
Right.
We can get you there. But if you don't have Medicaid and you don't have enough resources to pay the private pay rates, it's that group of people that really is the concern right now, and how do we meet their needs?
Well, I know that some people are using like Pelham Transportation, but that's kind of out of the norms or average person that needs transportation's pocketbook range. I mean, and I'm not dissing Pelham,
Right.
don't get me wrong, but I'm thinking of the monetary part
Well,
of this.
it is, and frankly, providing transportation is very expensive. You know, those big vans, they don't get great gas mileage.
Yeah,
They're
6
costly.
miles to the gallon,
They're
maybe.
costly to operate, and
Yeah.
so you know, Pelham, CJ Medical, A Safe Hands, and us are the 4 providers in town, and it is expensive. you know, we have to rely on grants and other things to help supplement that cost, which is how we can do it cheaper for these other populations. So,
Excellent.
yeah.
Excellent. So we want to remind folks that the new assisted living or
At-home assisted
living
Right.
has been launched as of today.
That's right.
So if you have any need for this, what am I trying to say, Lee?
This
Service.
bundle of services.
This bundle
right.
of
That's
services.
Right. That's right.
Give them a call at Aging, Disability, and Transit Services right here in Reidsville. Lee, what is the phone number?
They can reach us at 349-2343.
349-2343. All right, folks, thank you for watching. And Lee, thank you for bringing us all up to date on the new services we have here. And until we see you again next time, I'm Debbie Moore with Lee Covington.